So this is me, lots of letters that mean lots of different things. It's basically that means that I spent quite a lot of money when I graduated doing extra training in my spare time. So I qualified as a doctor in 2005, and first of all thought I was going to be a surgical doctor, then realized I didn't really have a life. But within that, I did a lot of ENT surgery, which actually mixes really well with allergies, because of course it's learning all about the ears and the nose, and that links in with hay fever and environmental allergies, and what might it be if it's not environmental allergies. And then I decided that I would train to be a GP. And it was during that I had Ethan, and then he obviously had milk and nut allergies, and I just realized I just knew nothing. And he and my GP and I would sit there and be a bit like, well, what do you think that he's reacted to in the rusk? And we'd be like, I don't know. And looking back now, nobody told me the most basic of things. Nobody told me how to read packets, and at that point they weren't as clear as they are now, so it didn't say milk in bold, but nobody ever had that conversation. Nobody told me what allergic reactions looked like, how to treat anaphylaxis. No one trained me with a pen, and it's no wonder really that he had so many exposures to milk, unfortunately, and several episodes of anaphylaxis. And eventually his consultant suggested I did some more training. So in proper me style, I did a degree when I was very heavily pregnant with my third babe. And then fell into the allergy world, really. I retrained with Southampton Children's Hospital, worked a bit with the adult team too. As you know, I have a private clinic now, but I previously chaired the primary care group of the British Society of Allergy and Clinical Immunology. And with them, after quite a lot of campaigning, we finally managed to get food allergies put on the GP curriculum. And if you can believe it, up until just a couple of years ago, as a GP, we had to know about eczema and asthma and hay fever, but we didn't have to know about food allergies. So it's no wonder that GPs are so ill-equipped on the whole. There are definitely fantastic GPs out there. There's GPs like me that do a lot of the guidelines and are well trained. And there's GPs who've had children with allergies or have allergies themselves. And hopefully you'll be lucky enough to meet them. But there's lots more work that still needs to be done. But they are trying, and I teach lots of them, and they're really keen to learn. It can be quite a complicated field. And we've already heard how I now work with Anaphylaxis UK. And I also help run the peanut immunotherapy clinic at Southampton still. So it gives me quite a wide range of skills, I think, because I understand what it feels like to have allergies, and for my children to have allergies, and to try and face the GP, because I am a GP, and to also work in hospital. So hopefully it gives me a grounding to help you all. So we're really going to have a look over the next kind of 10, 15 minutes or so about what is allergy and what else could it be if it's not allergy. So hypersensitivity is just the definition that means any unpleasant but reproducible reaction to food. And a food allergy is essentially something that occurs if the immune system has gone wrong. So when the immune system is doing something to something that should be harmless, like grass or milk or nuts or whatever it might be, and it's giving you signs and symptoms that shouldn't be there, then we know that's an allergy. And we will be able to tell that depending on what you describe, the timing involved in those reactions, and how long they last for. So they're very set things that an allergist or somebody who understands allergy will be asking you. The definition of an intolerance is a reproducible adverse reaction to food that doesn't have an immune mechanism. So because it doesn't have an immune mechanism, it's not an allergy. It's reproducible because it happens every time you eat the food. And sometimes we will know the mechanism behind it. So for instance, I'll talk about lactose intolerance in a minute. And that occurs because you have not enough of the lactase enzyme that you need to process lactose, which is a sugar that's present in things like cow's milk. But some mechanisms we have no idea about. And so when you go on the high street and they say, by this test, you'll be able to check all intolerances, it's a complete lie, because if you take lactose intolerance, for instance, the way that we would officially test that is by doing a special breath test, certainly not a blood test or a hair test. And as I've said, some mechanisms we don't understand. Celiac disease, for instance, you diagnose by a blood test and then a camera test down into the food pipe. So don't spend your money on intolerance testing. The other thing that you'll find is that they will measure something called the IgG, which is a type of immune cell called immunoglobulin G. And we've just said an intolerance doesn't involve the immune system. So it makes no sense that we're checking an immune cell. And the only immune cell that is involved in allergy that you can measure is the IgE. So it's just really important to understand what people are selling you on the high street and where their place is. So everybody worries about lactose intolerance. And sometimes when GPs are a bit misguided as to what the problem is for babies often that are reacting to milk, you'll get told that they have a lactose intolerance. And that's actually really incredibly rare. So lactose, I've said, is the sugar. And in our large intestine, we have the enzyme lactase, which is present on like long hairs that live on the side of the gut. And so if you had a really nasty tummy bug, for instance, then you get a lot of inflammation in the gut and it might kill off those hairs for a period of time. And therefore you might lose that enzyme until everything is fully healed. So until the gut infection is gone and everything has come back together, then you may have a period of time where you don't tolerate lactose products anymore. And that does very commonly happen in like 2 or 3 year olds. If they have a nasty tummy bug, for a while, you will newly notice that if you give them milk, they get really bad diarrhea. But if you gave them lactose-free milk, it would cure the problems. But if you gave a child with a milk allergy, lactose-free milk, it only takes out the lactose carbohydrate sugar. It doesn't remove the cow's milk protein itself, and therefore the child would still react. When you don't have that enzyme, what happens is all the water gets pulled into the gut, the bacteria ferment and go horrible. And the consequence is that you'll get very quick onset of tummy pain, bloating, wind, and diarrhea. And it does happen really quickly, which often with food allergy, it happens really quickly. But it's usually a temporary thing. So there are different types of lactose intolerance. So the secondary lactose intolerance occurs because you've got some inflammation in the gut, and when it heals, it will come back together. If we were saying very small babies of like 2 or 3 months of age have a lactose intolerance, then essentially we would be saying that they were born without their lactase enzyme. And whilst that does happen in some populations, like some Japanese populations or some people from Finland, it's so rare in the UK, I've never seen it. And we certainly don't routinely test for it. So if you have a baby that's like 2 or 3 months old with issues with their gut, really, we're going to be more thinking, is this a milk allergy? And being given lactose-free formula isn't going to cure the problems. The other thing we sometimes see as you get older, so not relevant for our group tonight, but teenagers and young adults, sometimes you start to have just a bit less of the lactase enzyme. So you'll find that they'll say like, oh, I can eat cheese and yogurt, but if I have a milkshake, I get a really bad tummy and diarrhea. But if they have lactose-free products, again, it doesn't cause them any symptoms. And it's just because as we get older, all of us can't really process dairy quite so well. And we've probably just got a bit less of the lactase enzyme. And you actually can buy lactase granules from the health food shop, and you can add them with your ice cream, and often it will improve your symptoms. So I'm going to talk about the different signs and symptoms in the body that we would get with the different forms of allergy. And I'll spend a few minutes going through because they are a bit complicated. So these are according to the NICE guidelines, and they break them down into the different organs. So you get the skin, the gut, and we get respiratory symptoms. And I'll explain the medical terms as we go. So the IgE allergies are the ones that usually people recognize because they normally come within minutes to an hour or so after you've eaten the food, every time you eat the food, and they normally give you really obvious symptoms. So they give you pruritus, which is itching. Erythema just means redness. The urticaria means hives, so like those nettle sting rashes that you see with the raised bumps. And angioedema is a really fancy term that just means swelling. So it normally happens in front of your eyes. This is what happened with Ethan, and it was really obvious. Now, the non-IgE allergies are really hard to figure out, and they can cause the itching, the redness. They often just make these babies look a bit rashy. And there is a link here with eczema. But there's lots of families on here with children with eczema. And I always spend my life saying the fundamental issue with eczema in a little one is that you genetically have a mutation of a gene that's responsible for the skin barrier. So it dries itself out. So it's the genetics that have meant that your child has been born with eczema. And no external factors, no food, no cats, no dogs, no dust, nothing is actually causing that eczema. And therefore, there is nothing you can actually do to cure it. But where the allergy comes in here is that when you still have a food that you're allergic to with these non-IgE allergies, the eczema will become very hard to control. And I always warn families, so if you think your child's got like a milk allergy or a soya allergy, when you remove that food, sometimes the eczema looks better and sometimes it looks like it's gone. But I guarantee you it comes back. And the important thing is to try not to fall into the trap of going, what else is causing it? Because often it's just the fact that the eczema is there and it will keep coming and going, as Adette will talk more about, I'm sure, later. For the gut, so when we look at the immediate allergies, you might get swelling in the mouth, itchy mouth, and little ones, mine used to say that the food tastes spicy. They'll push it away. And they might get immediate onset of tummy pain, vomiting, and diarrhea. And for the non-IgE allergies, it's all about the gut. And I divide it into the upper gut and the lower gut. And you will usually find children with non-IgE allergies have at least two systems involved. So they might have skin and lower gut, or upper and lower gut, or congestion and some skin and a bit of gut. So they have more than one symptom. So with the upper gut, they get reflux. So they're uncomfortable when they feed. They arch their backs. They might go a bit blue around the mouth, which definitely just needs checking out. They tend to be really unsettled and cry for hours and hours and hours because their gut is so inflamed and they're so uncomfortable. They might have loads of loose liquid nappies that you describe as punamis, and there may be mucus in there, but it's not the main feature, but in addition with everything else. And if they're breastfed or combination fed, then sometimes they will get blood in the stool as well. Or they may get constipation. But the constipation we tend to see is where they've strained and strained, and when they do go, it's soft rather than hard. They might get redness around the bottom. And if they're really severe, that's when you might see the height and or the weight dropping. But I always try and say to GPs, don't falsely reassure families there's nothing wrong just because they might be growing well, because you can still have a non-IgE allergy and the growth not yet be infected. So, but you can still have a very miserable baby, very unhappy families, and it still needs treating. And then finally for respiratory, so with the immediate allergies, you get a bit what looks like hay fever when you're allergic to the food. So if you're allergic to sesame, you might get a runny nose, sneezing, itchy eyes, or you might have signs of anaphylaxis that we'll talk about in a moment. And the NICE guidelines don't recognise that the non-IgE babies have any respiratory symptoms, but another set of guidelines that you might have heard of called the MAP or the IMAP guidelines, which are the International Milk Allergy for Primary Care guidelines, do say that these babies tend to be very grunty and congested. But again, they wouldn't just have that. So if you just had a snotty baby, we're not likely talking about food allergy. But if you have a snotty baby and gut symptoms and difficult eczema, then it raises the possibility that it might be allergy. So this is from Anaphylaxis UK. And it's a really good poster that you can put out, but it reminds you of the signs of anaphylaxis, which is ABC. So A is for airway, so coughing, the voice might go croaky or hoarse. There might be tongue swelling or dribbling, breathing difficulties, noisy, hard to breathe. And C is for conscious level or circulation. So an older child might tell you they feel dizzy. Baby might go very floppy. And on the worst end of the scale, then they may collapse and their blood pressure may drop. Important things people should know: if you're having anaphylaxis, you should not move. If you've got breathing problems, sit up. But if you haven't, you should lay flat and lift your legs. Now, obviously, that's hard if you've got a baby or a toddler, and you might have to go with the flow, because if you stress them out, it might make it get worse. But if it was an older person or an older child, ideally, don't let them move around. If you've got adrenaline auto-injectors, you give it and you ring 999 after you've given it. And if you don't have adrenaline auto-injectors, you just get straight on and you ring 999 and you say you think they're having anaphylaxis, and it will prompt an urgent response to you. A little reminder about the allergy test. So the only tests we can do are to confirm an IgE allergy. It's just the hardest thing in the world at the moment with non-IgE allergies, because they have not designed a test yet to diagnose it. And the only way we can diagnose it is by removing the food for 2 to 4 weeks. We look to see have things got better. And if so, we ask you to retry it to confirm it was definitely causing a problem. Don't use any testing, like I've said, of the IgG. The patch testing is for dermatology with like chemical reactions. Vega testing, kinesiology, hair analysis, they have no scientific basis to them. So to diagnose IgE allergies, GPs could do a blood test for you, and an allergist might do skin prick tests. And ultimately in hospital, we might even do food challenges where we give some of the food and we look to see, are they reacting or not? I'm going to mention 2 more unusual forms of non-IgE allergy in case it affects your family. So they've got long names. So FPIES, which stands for Food Protein Induced Enterocolitis Syndrome. We have seen it in adults too, but it's more common in children. And it's very hard to spot. And it tends to cause a lot of vomiting, anywhere between 1 to 6 hours after the food has been given. And in a small proportion, so about a quarter, have diarrhea as well. And usually they vomit so much that they often look awful, they collapse, they get rushed to A&E. And people think that they're septic, that they've got horrible infection, but all the blood tests come back normal. They get given fluids, they get better, they go home. No one really knows what happened. They get given the same food again. And for instance, it might happen the first time you give cow's milk formula, and the same thing happens again. And it's only when it happens a few times often that people realize what the problem is. And there's a great charity again at the bottom that I've listed, fpiesuk.org. The other one is eosinophilic esophagitis, or we call it EE, or in America they call it EOE. And it's definitely on the rise. In America, they're seeing it very commonly in children. And it tends to give children and adults really bad indigestion. They might describe that the food feels stuck, or it might even come back up. They might get chest pains. And I've put not responsive to PPIs, which is a proton pump inhibitor. So it's the medicines like omeprazole or lansoprazole. They don't make things better. And the only way of diagnosing it is a camera test down into the food pipe. And then there are specialized treatments that they might do. So they might do dietary restrictions, or they might give medications. But again, these 2 can't be diagnosed with a blood test. FPIES, there is no test. So they're really, again, they're very hard illnesses to spot and diagnose, and you definitely need specialist help. So I just thought I'd put in a couple of slides to give you a taster as to more of what we'll talk about on the course, which is, well, if it's not allergy, what else might it be? And this is one of the biggest group of issues we see with particularly babies in the kind of first few months to year of life. And they've got a really long name again called functional gastrointestinal disorders, which sound terrible, but actually essentially what we're saying is they're almost a part of development. And they affect almost 55% of infants. So more often than not, if you've had 2 babies, there's likely that one of them had this. And if they had blood tests, they would be normal. Examinations will always be normal. And they're things like colic, toddler diarrhea, some other forms of diarrhea, some forms of chronic constipation, regurgitation, where the baby just brings all the milk back up. And we can usually tell as a GP from examining and the things that you say, and there are set criteria for diagnosing them if these are the issues. But you might remember from some of the slides I shared earlier with the non-IgE allergies that some of those symptoms of diarrhea or constipation or colic cross with these functional gastrointestinal disorders. So it really does take someone experienced to understand, well, which one is it? And again, as I'd normally say, the non-IgE allergies will probably have several symptoms, whereas the functional gastrointestinal disorders probably just one. But all babies need to be examined to make sure that they seem healthy, that the examination is normal, they're growing well, before we might say, is this? And then finally, another condition, again, with a really long scientific name. We just make them up to annoy you. But chronic, because it means it's gone on for longer than 6 weeks. Spontaneous, because it's happening randomly. Urticaria means hives, and angioedema means the swelling. And this affects all age groups. It's said to affect about 10% of the population at some point in their lives, so 1 in 10. Some people just get hives, some people just get swelling, some people get both. Often in children, it's triggered by infections. So things like COVID trigger hives. And if you are an allergy family, you're going to immediately think something's happened to them. And really frustratingly, if you have allergies, quite often these children will just have very fragile cells that contain the histamine. That's the chemical that triggers these reactions. And if you put a bit of pressure on their skin, like around a waistband, or they knock themselves, or it gets hot, they will often have hives just because of that. And so we will talk more in the course of how do you know whether it's these random hives or whether it's actually a food allergy and you need to worry about have they been exposed to something. This particular condition happens all the time, on and off, can be for years and years, often in the middle of the night to begin with. So people often go, what did you eat last night? But usually these IgE allergies that make hives tend to give symptoms within an hour, so not in the middle of the night. No triggers will be found with this condition. Allergy tests are completely pointless. And really, it's about how they tell us if these hives and swelling keep coming and going, they've last for weeks, then it's very likely this condition. We don't really know why it happens. It's something in their own body triggering the release of histamine. And so the treatment is very high doses of antihistamines. You have to chat to your doctor, but we use up to 4 times the normal dose, even in little ones. And then it can be quite effectively treated. So just so you know, if you're struggling with your GPs, there are guidelines of who should be referred to an allergy specialist. And it's basically if you've had any concerns that they've had anaphylaxis, if they are multiply allergic, if they have asthma and an IgE allergy, they're at higher risk of anaphylaxis. Obviously, if there's worries about their growth, if they've got really bad eczema and you think that's linked to allergies, I often try to say if they're an older child, a dermatologist might be more appropriate. But certainly the little ones where we know that they've got higher risk of allergies, NICE would say they should be referred. And finally, a really nice one for you that says if you are suspicious as a parent that they have an allergy and the GP's assessed it and they don't think that they do, you can still ask for a referral. And you should take these guidelines along if you're struggling.